There are 4 people in this picture. That's me over here. And next to me is my mom. This is my Aunt Joyce. This is my cousin Karen. At this particular time, none of us had had cancer. Not one of us. But within 3 years of this picture, 3 of us would. My name is Tracy Kimbrough. I am 59 years old, and I am a breast cancer survivor.
With the sheer number of new diagnoses each year, cancer can feel universal. But if you dig deeper into the numbers, you'll see a reflection of inequality in America when it comes to cancer rates. While Tracy's story is uniquely her own, she's seen the impact of such disparities on a personal level.
Black women, statistically, we are diagnosed at about the same rate as white women, but our mortality rate is 40% higher. We are 40% more likely to die of breast cancer. So you have to ask yourself, well, why? That's it, the big question, why?
Cancer deaths in the U.S. have been declining since the 1990s. Despite the efforts of organizations like the American Cancer Society, serious gaps in cancer prevention and care still persist. And that explains why Black people have the highest death rate and shortest survival rate of racial and ethnic groups in the U.S. for most cancers. For Tracy, these inequities hit close to home. She was motivated to get screened due to her family history.
Our family's history with breast cancer goes all the way back to my maternal grandmother. My sister was cancer-free for 12 years, and then it came back, and it had metastasized in her chest wall. When you get a diagnosis like that in your own generation, that changed everything. I was actually at my annual physical, and as she started doing the breast exam, she went over one place like twice, and I felt her hesitate. And my world as I knew it just crashed right then and there.
My name is Dr. Clifford Eke. Well, disparity in general occurs in healthcare, but in cancer specifically, it can occur in incidence, for example, how often the cancer occurs, in prevalence, how common it is, in the treatment even, in the mortality, and even survival.
To better understand these disparities, ACS is supporting research into why inequities exist and how to decrease them. Given the prevalence of breast cancer in Tracy's family, she was tested for BRCA1 and BRCA2 gene mutations. Women who have the BRCA mutation face an elevated risk of breast and ovarian cancer.
They scheduled me for a double mastectomy. You talk to the average African-American teenager or person and ask them about BRCA gene, they'll probably tell you, what's that? And when they go to the doctor, if they go to the doctor, often doctors don't talk about that. This is why we need representation.
The main big part is racial discrimination and bias. And maybe they don't trust the healthcare provider. So we have to get someone that has their background to give them culturally sensitive and appropriate information.
One way to ensure that is by having researchers reflect the communities they're serving. And right now, that's not happening enough. So to increase the number of minority cancer researchers, the American Cancer Society's Diversity in Cancer Research program invests in medical schools at historically Black colleges and universities. Tracy is putting in the work too. She volunteers as a peer-to-peer mentor. She helps people coping with their cancer diagnosis.
Everyone's cancer journey is different. The one thing that I think is universal for us cancer survivors as we start the road to recovery is you start to feel like you're gaining control back.
Though cancer rates are declining, the disparities continue. Unlike a game of cards, it can't be left to chance. Structural inequality must be confronted.
But in medical schools, and us as doctors, we need to be trained in cultural sensitivity and being aware of our own biases.
On the federal, state, and local levels, ACS is advocating to improve health outcomes and reduce disparities in the U.S. Tracy is committed to helping close these gaps by telling her story and educating others.
I feel that no one should ever have to feel like I feel whenever I think of the possibility of losing my sister. This is why I do what I do.